One of the silver linings of this pandemic has been the emphasis people are now putting on their mental health. Ian Bolland from BPW Assessment and Consultation Services is here to explain more. How are you?
I'm doing well. How about yourself?
I'm doing well too. I'm happy to have you here. So explain what your services are, or what services are actually provided by your company.
Yeah, so we offer a wide range of services from various psychological assessments, so adult evaluations, child and adolescent psychoeducational evaluations, bariatric testing, and then from there we also offer tutoring and various things that different people can use.
Just to help them navigate this time. I mean, it really has been a difficult time for a lot of us. I mean, when you get an unexpected global pandemic, it can throw you for a loop. You might need some added help. And I know that you also offer tutoring and educational advocacy, which is sort of atypical sometimes when you think about practices that focus on mental health, right?
A little bit. I mean, with tutoring services and educational advocacy, it really kind of ties it all together because a lot of the time with different IEPs or 504 plans, there will be a diagnosis needed.
Got it. That makes a lot of sense. And I assume that you guys are seeing a lot more of that, or are you seeing more of that in this era post-pandemic?
Yeah, there is definitely a bigger need for different psychological testing or therapy or medication management in general.
So if someone is struggling and they've just now come to realize that they are struggling, what are the first steps and where do they even begin?
So they can begin by, calling us, making an appointment, and a lot of people will come to us with some type of initial diagnosis, whether that be maybe a unspecified anxiety disorder, and then they will do the psychological testing to get a more specific diagnosis, whether it's maybe a phobia or a generalized anxiety disorder.
And so once there is a definitive diagnosis, what happens next?
That's a good question. So after there is a definitive diagnosis, the psychologist will then recommend different treatment options.
Okay.
And those can range from different medication management, therapy, acupuncture, nutrition, maybe some type of yoga services or even dance.
And you touched on this before, but I want to backtrack too, because you mentioned the bariatric treatment as well. Before someone actually gets that procedure, they want to make sure that they are in the right mindset, right? Or the mind frame. Is
Yes,
that correct?
that is correct.
Okay, so they can come to your practice for that as well.
They can.
All right, great. So someone is watching and they're going to fall into one of these categories. How do they get in touch with you and make an appointment?
So they would go to bpwassessments.com, and then from there, there is a contact us and just basically send us an email.
Contact you. There you go. Ian, thank you so much for being with us. We really appreciate it, especially right now. People are getting into the swing of things again. We want to make sure that they are taking care of their mental health. So thank you for being here, and we'll be right back with more Midday Maryland right after this. Stay tuned.